Okay, today we're talking about lateral epicondylitis, and we're talking about the treatment protocols that are associated with this condition. And what you're seeing here is eccentric contractions of your wrist extensors. Lateral epicondylitis is associated with the extensor carpi radialis longus and brevis, as well as the brachioradialis. Studies have shown that if you help passively raise the wrist and lower it down with an eccentric contraction, tends to promote healing of those origins of those muscles. And I'm going to show you what an iontophoresis treatment looks like for lateral epicondylitis. Let's slide right over here, and explaining the anatomy is important, and so that the patient understands what's going on with this condition. So that's usually, there's an educational component to it. Here we have a Activa iontophoresis patch, and you can see that right under the label it says 2.0 cc fill volume. That means that you will use your dose based on the size of the active electrode. So if you turn it over, you have two patches. Both of them have adhesive to them. One of them has this little sponge-like receptacle, or it is the active electrode that allows you to put your treatment medicine on it. Electronically, it's connected through a little battery in the center, and if you lift it up, you will see that there's a little arrow that you pull out to activate it once you get it in place. This is considered your active electrode, and then this is considered your inactive electrode on the right side. One is basically called a disperser pad. So now I am going to film putting on the 2 cc's of our medicine. So the medicine that we're using here is dexamethasone sodium phosphate at a 4 mg solution. That's 4 cc's percentage of dexamethasone sodium phosphate. This is a steroid that tends to reduce inflammation. So P directly added to the active electrode.